some of the stigmas that people need to be aware of is that it's confidential. People tend to think, especially with the health department, going into their local health department, that people tend to discuss what's going on within the health department, and that's not true. That's something that, we all think that people are discussing diagnosis, but again, that's not true. HIV testing is very complex, and it's left entirely between the tester and the client that comes in. So we want people to know that, coming to the health department is not a bad thing, and it is safe.
If you will, Jora, can you talk about the theme for this year with ADPH as far as World AIDS Day? I know you all have like a theme.
It's ending the HIV epidemic. Everyone's, equitable access in everyone's voice. Sorry.
Okay, and can you run that back for me one more time?
It's ending the epidemic, ending the HIV epidemic. I'm sorry. Equitable access in everyone's voice.
Okay, excellent. And can you just explain that a little bit, what that means? And
We want people to know, and we want the public to know that equitable access means that services that you need for HIV is available to you. You just got to know where to go and where to find this information. Information can be found on our website, or better yet, our app. If they download our KML Alabama app, they will have a list of all of the 8 service organizations and community-based organizations that offer free HIV testing, along with confidential HIV testing. Everyone's voice, we want, again, people to use their voice, and knowing that it's okay to talk about HIV. HIV now is considered a chronic disease because, again, it's treatable. And it's not a bad thing. We do want to make sure that no one gets HIV or is diagnosed with HIV, but we want to make sure that people are treated if diagnosed or has a positive diagnosis. And if they're not positive, we have other services available that will prevent you from being positive.
that is excellent. That is excellent. And my last question, so we talked about the theme. I think you all had a goal this year about reaching toward a certain reduction of new infections. Can you talk
Yeah.
about that a little bit too?
So that campaign is actually the Ending the HIV Epidemic campaign. It started with the previous administration. So the goal is by 2030, 2030 is to decrease cases by 90%. So that's the goal that we're trying to reach. But in order for us to reach that goal, we are trying to recruit new voices. New voices meaning that someone who is not affiliated with an AIDS service organization or a community-based organization or has anything to do with HIV. We want to recruit those community lay workers or the gatekeepers in the community to help us reach that goal. So if you are interested, this is my plug. If you're interested, please visit our website at www.adph.org/HIV for more information about joining our Ending the Epidemic work group.
That's great. Thank you so much for sharing. Jora, was there anything else that you wanted to add? Because I know you all have been doing this since what? I think I read 88. So it's been, I guess, what, 34, 35 years or so that
Yeah.
you all have been pushing this awareness, essentially. Was there anything else before we wrap up?
No, I do want to say again, just really encourage people who has an interest in helping us end the epidemic to please visit our website, because we are very serious with decreasing the number of new cases in the state of Alabama, as well as assisting those persons who are quite fearful in knowing their status. We want to help them get tested as well. So that's it.
Thank you. Last question. I don't know if you have any stats or anything, just real quick. How is the rate of infection here in Alabama? Is it how is it, would you say, compared to the national rate?
Compared to the national rate, is pretty high. That is one of the reasons why we were awarded the Ending the Epidemic funds. The state of Alabama could possibly use the money, which is a good thing. But it's also bad to be recognized as a state that has so many HIV cases. So again, with the new Ending the Epidemic campaign, we know that since the inception of the program, we have been pushing being tested and knowing their status. But what we have done, I'm not going to say it has not worked. We just needed to work a little bit better. And the federal government feels like if we can get those lay community persons to be more involved, that people will be more apt to go out. So when I say community persons, we're looking for people who are affiliated with churches, maybe your local grocery store person, hairstylists or barbershops, interest in helping us end the HIV epidemic. So the numbers, yes, are very high in Alabama.
And do you have any specific numbers you could provide?
I don't have any right now. I haven't pulled those numbers yet, but we do have them on our website. But so I'm not real sure about the numbers, and I don't want to give any wrong information.
Right.
But again, I do know that the numbers are very high simply because we were awarded the money. And the thing about the Ending the Epidemic money, every state wasn't awarded. So I think it was like 13 states and 7 states were selected, and I think what was it? A couple of islands were selected as well.
Wow. Yeah, because I'm looking and I see according to the CDC about 1 in 7. In 2015, an estimated 481 adults and adolescents were diagnosed. Alabama was ranked 22nd among the 50 states in the number of HIV diagnoses.
Mhm.
So that's according to the CDC. And I see you all do have a report up, some statistics that was released not too long ago, the end
Mhm.
of September. So I'll look at that. But thank you so much. That's very helpful. Kind of put things into perspective as to why Alabama is pushing that awareness. Yeah,
Yes.
yeah. Thank you so much. Well, in case you're wondering, this will probably air tonight at 5:30 or at 9. And
Okay.
I'll be sure that same email that I sent you the Zoom link to, I'll send you the article to that as
Thank
well.
you.
Absolutely. Thank you for taking the time out. And I love your button. That's really,
Thank you. If you
yeah.
want us to send you some, just let me know. Send me your address and we can get you some.
Oh, really?
Yes.
Okay, okay. I'm gonna take you up on that offer.
Okay. Thank you.
Thank you so much. Have a good one.
You too. Bye-bye.
Bye-bye.